In this video, we will explain how to perform an INNO-LIA assay. We will take you through the procedure step by step and demonstrate how to test a sample using the INNO-LIA assay. Before we start, we have some general lab requirements. Because this procedure requires working with infectious samples, safety guidelines should be respected at all times. That's why gloves, shoe protection, and a lab coat are essential. Specimens, positive control, and negative control should always be handled as if they are potentially infectious. Waste should be handled according to the applicable waste disposal guidelines. To avoid risk, it's important to wash hands with disinfectant soap after each visit to the infectious lab. This lab should be equipped with aspiration equipment, a shaker, or in case of automation, an Auto-LIA or Tendigo instrument. This is the INNO-LIA test kit. All of the required reagents are provided in the kit. To begin the test, let the reagents come to room temperature. This is an essential step to ensure accurate results. Be sure to remove the reagents from the box at least 60 minutes before use. All of the reagents are ready for use except for the wash solution. This needs to be diluted 1/5, meaning 1 part wash solution should be added to 4 parts distilled water. Take the required number of test troughs. For each run, a positive and negative control can be included. Use a marker pen to identify the test troughs. First of all is the sample incubation step. Add 1 milliliter of sample diluent to each test trough. Add 10 microliters of sample or control to the appropriate trough. The INNO-LIA HIV and HCV score products have a 3-hour as well as an overnight procedure. The overnight procedure, including a 16-hour sample incubation, requires 10 microliters of sample, while the short procedure requires 20 microliters of sample. It's important to be aware of the different sample volumes depending on the test procedure you want to run. Take the required number of strips from the tube. There is a number and product-specific code printed on the plastic backing of the strips. Use tweezers to add 1 LIA strip to each trough. Place the strip with the membrane side facing upwards. Do not touch the membrane of the strip. Always handle the strips using the plastic backing. Make sure the strips are completely submerged in the reagent. If necessary, use a clean pipette tip to push the strip into the fluid. Be sure to use a new pipette tip for each trough to avoid cross-contamination. It's essential to cover the troughs with an adhesive sealer to avoid the strips drying out during the sample incubation. Incubate the samples by placing the tray on a shaker or rocker. A rocker should only be used for the overnight procedure. The speed of the shaker or rocker is critical to obtaining even line staining and maximum sensitivity. The strips should move backwards and forwards in the troughs without any liquid spilling over the edge. The recommended speed for an orbital shaker with 24 mm circular motion is 90 RPM. The strips are incubated with the sample for 16 hours at room temperature. Room temperature is defined as 18 to 25 degrees Celsius. A deviation outside the incubation period is permitted up to a maximum of 2 hours. Prepare the wash solution using the sample incubation. The wash solution should be diluted 1 part solution to 4 parts distilled water. The diluted wash solution is stable for 2 weeks if kept at 2 to 8 degrees Celsius. The adhesive sealer should be removed carefully to avoid cross-contamination. At this point, it's necessary to wash the strips thoroughly. Wash each strip 3 times for 5 minutes using 1 milliliter of wash solution. It's now necessary to use a vacuum aspiration system to remove the reagent. Hold the tray at an angle to allow all of the liquid to flow to one side of the trough. Be careful not to damage the surface of the membrane when aspirating. It's very important to completely remove all of the reagent from the troughs. Then, add 1 milliliter of diluted wash solution to each trough. Add the reagent gently to avoid splashing it over the edge of the troughs. Make sure that the strips are fully submerged in the solution to ensure that they are washed thoroughly. Every step of the incubation process, including the washing step, should be performed on a shaker or rocker. Wash the strips for 5 minutes. Repeat this step twice. The next step is the conjugate incubation step. Remove the wash solution from the troughs. It's essential to completely remove all of the reagent from the troughs. Then add 1 milliliter of conjugate solution to each trough. Make sure the strips are completely submerged in the solution. Incubate with the conjugate by placing the tray on the shaker or rocker and agitating it for 30 minutes at room temperature. Room temperature is defined as 18 to 25 degrees Celsius. After the conjugate incubation step, the strips must be washed again with washing solution to completely remove the conjugate. Wash each strip 3 times for 5 minutes using 1 milliliter of wash solution. Hold the tray at an angle to allow all of the liquid to flow to one side of the trough. Add 1 milliliter of diluted wash solution to each trough. Add the reagent gently to avoid splashing it over the edge of the troughs. Make sure the strips are fully submerged in the solution to ensure that they are washed thoroughly. All incubation steps, including the washing step, should be performed on a shaker or rocker. Wash the strips for 5 minutes. Repeat this step twice. The next step is the substrate incubation step. Remove the wash solution from the troughs. It's essential to completely remove all of the reagent from the troughs. Add 1 milliliter of substrate solution to each trough. Once again, make sure that the strips are completely submerged in the solution. Incubate with the substrate by placing the tray on the shaker or rocker and agitating it for 30 minutes at room temperature. The next step is the stop solution incubation step. The color development is halted by washing the strips in stop solution. Remove the substrate solution from the troughs. Add 1 milliliter of stop solution to each trough. Once again, make sure the strips are completely submerged in the solution. Incubate with the stop solution by placing the tray on the shaker or rocker and agitating it for 10 to 30 minutes at room temperature. Remove the stop solution from the troughs. Use tweezers to remove the strips from the test trough. Put the strips on absorbent paper with the membrane side facing upwards to allow them to dry. Interpretation should only be done when the strips have dried completely. This is the AutoLIA 48 instrument. To start the test, use the on-off switch on the back panel of the instrument to switch the instrument on. Wait until the instrument displays Main Menu. Select Run to put the instrument in standby mode and ready to start an INNO-LIA run. Fill the bottles with the correct reagents and place them inside the instrument on the corresponding colored spots. Insert the tubes into the bottles with the corresponding color code and number. For example, the tube with the green marker labeled number 1 should be placed in the sample diluent bottle. Make sure that the end of the tubing is submerged in the fluid and that the tubing is not bent. Alternatively, for small runs using only small volumes, conical tubes of 50 milliliters and 15 milliliters can be put into the dedicated bottles, for which less excess volume is needed. Press the Yes key of the Run Program display, Standby Mode. The message, Waste Bottle OK, will appear. Check the volume in the waste bottles. Then press Yes to confirm when the bottles are OK. On the next display, select a specific test method using the plus and minus keys. Then press Yes to confirm your selection. The instrument should display Insert Tray. Use tweezers to insert the strips into the center of each trough, membrane side up, only 1 strip per trough. Load the tray into the AutoLIA 48. Make sure that the tray is well positioned in the tray holder. Close the front cover. The test will not proceed if the instrument cover is not correctly closed. The next 3 displays indicate parameters that must be defined before a run can begin. Start position strips. Every third trough can be selected, for example 1, 4, 7. Number of strips to be run, 1 to 48. Select the start position for channel 1. Sample diluent must be added manually to the cutoff control. The start position for the distribution of sample diluent channel 1 by the Automate should therefore be selected in function of the position of the cutoff control in the tray. Final aspiration step. Choose Yes or No. When performing a run overnight, it's better to delay the final aspiration step. To do this, select No. The strips will then remain in stop solution. The first step of the test procedure is displayed. Press Yes to start the run. Sample diluent is added and a 1-minute incubation step is performed. Step 3 of the protocol is a pause in the test run, when the shaking will stop. Carefully remove the tray from the instrument. add the samples or controls to the appropriate troughs. Check that the strips are not stuck to the sides of the troughs and are positioned membrane side up. Carefully reload the tray into the instrument. For the short protocol, cover the test troughs with adhesive sealer, leaving an opening of at least 4.5 centimeters from the side of the tray for dispensing and aspiration of the reagents. In the case of a 16-hour sample incubation, it is advised to cover the test troughs completely to avoid evaporation of the reagent. Be sure to remove the seal before the end of the sample incubation, otherwise it will hinder the aspiration and dispensing head. Continue the test run by pressing Continue on the pause display. The run will start again. The AutoLIA 48 must be cleaned after every run with distilled water and once a week with a cleaning solution. The recommended cleaning solution is 2% SDS and 0.1% tween 20 in distilled water, which is then heated to 60 degrees Celsius. Starting from standby mode, select the liquid preparation menu. The display will show liquid prep using the left or right keys. Confirm with the yes key. Proceed to the auto clean display, again with the left or right keys, and confirm. When the clean liquid display appears, place all the reagent tubes in the distilled water or cleaning solution and press yes to confirm. When the distilled water display appears, place or leave the reagent tubes in the distilled water and press yes to confirm. Next is the tub cleaning step. When this step is complete, continue by pressing any key. When the Remove Water message appears, press Exit. The tubes will remain filled with water as this prevents crystallization in the tubing. Press Exit again to return to standby mode. After cleaning with cleaning solution, run the Auto Clean program 3 times with the distilled water to remove all traces of the cleaning solution. Tendigo offers automated processing of INNO-LIA and INNO-LIA tests from sample incubation to color development. It offers walk-away processing of up to 10 strips, fully automated reagent addition and aspiration, overnight processing, and built-in failure detection. Switch the instrument on using the on-off switch at the back panel of the instrument. The instrument will start the initialization procedure and will display the following message: Clear instrument for self-test. Before the self-test begins, a message will appear on the display asking the user to check that everything is ready in order to avoid a collision of the moving aspirate and dispense unit with the other parts of the instrument. Make sure that the containers and the container lids are in position. The heated lid is down and closed using the closing switch. When everything has been checked, press the Done button. After the self-check procedures are complete and the OK button is selected, the instrument proceeds to the main mode. Select Run Protocol and press OK. From the protocol selection screen, select the protocol by using the down and up buttons. The OK button is used to start the selected protocol. To start the run, press OK. The run starts from the first protocol step. Check that the waste bottle at the left side of the instrument is empty and that the waste tube is inserted into the waste bottle. Check that the reagent containers are in place and filled with the buffers needed for the entire run. Pour the required buffer volumes into their respective containers. Check that the water container is filled with 150 milliliters distilled water. Check that the plastic lids on the reagent containers are in place in order to prevent evaporation. When everything has been checked, press the OK button. Close the heated lid and the transparent cover using the closing switch. Every run begins with a cleaning procedure using the H2O container liquid. This step is mandatory and cannot be skipped. While the instrument is preparing for the run, the strips can be placed into the tray. When the instrument is ready to proceed, an audio signal will be generated. The user can open the cover and the heated lid and insert the tray containing the strips. Check that the lid is correctly closed using the switch. Close the cover. When ready, push the OK button. You can define how many strips you would like to process. First of all, indicate the start position by scrolling up or down. When the correct start position is displayed, press the OK button. Then, select how many strips have to be processed using the up or down buttons. When the correct number is displayed, press the OK button. The following steps in the process are automatic, and the protocol progress can be seen on the display. After the addition of sample diluent, the TendiGo instrument will pause to add the samples to the tray. Add Sample will be displayed on the screen. The final aspiration step can either be skipped or activated. By pressing the OK button, the final aspiration step will be activated, and the reagent will be aspirated. After the last protocol step, the instrument is cleaned automatically using liquid from the H2O container. Open the cover and the heated lid, remove the tray, and remove the strips from the tray using tweezers. It's important to remove the strips from the tray to let them dry. Otherwise, background coloration or spots can appear on the strips and make interpretation difficult. The developed strips are now ready for interpretation according to their respective kit inserts. The cleaning procedure must be carried out each week and before an extended period of disuse, 1 week or longer. This prevents the formation of crystals from the reagent solution in the dispensing system. If this occurs, the instrument will malfunction or may require expensive repair. Select Clean TendiGo. Add 160 milliliters distilled water to the water container with distilled water. Add 60 milliliters detergent solution, 2% Contrad diluted in distilled water, to reagent container 2. Close and lock the tray lid. Close the cover. Continue the run by pushing OK. Wait for the cleaning cycle to end. This will take 40 minutes. There are a few critical points in the process to remember. Always let the reagents come to room temperature before starting the procedure. This is an essential step in the process to ensure accurate results. It's also very important to be aware of the different sample volumes to use, depending on the test procedure you want to run. Always be sure to cover the troughs with an adhesive sealer to avoid the strips drying out during incubation. And be sure to completely remove all of the reagents from the troughs after each incubation step. This is how to interpret the results of the LIA strips. Each LIA strip contains control lines and antigen lines. The positioning of the lines on the strips are as follows. There are 4 control lines. The first line is the background control lines. The second line is the 3+ control line. The third line is the 1+ control line. And the fourth line is the plus or minus control line. The antigen lines are separated and fixed in well-defined positions. The developed strips can be attached to the data reporting sheet. Use the reading card for correct interpretation. The 3+ control line on the reading card should be aligned to the 3+ control line on the developed strip. The developed strips can also be interpreted automatically using the LIA's scanning and interpretation software. In this case, the developed strips have to be attached to the LIA scan template. For additional information on the LIA's software, please check our website or contact our customer support department. The first step is to check the validity of the control lines on each strip by checking the validation criteria. 1. The control levels 1+ and plus-minus, as well as the strong control level 3+, should be visible. 2. The intensity of the control line 3+ should be higher than the intensity of level 1+, and the intensity of level 1+ should be higher than the intensity of level plus-minus. 3. The background control line should have a negative rating. This means that the intensity of the line should be weaker than the plus-minus control line. For quality control purposes, a positive and a negative control can be included in the run. The validity of the positive and negative control strip should be checked before reading the test results. The positive and negative control strip should show a reactivity pattern as is described in the package insert. A rating is assigned to every reactive line on the strip by comparing the intensity with the intensity of the control lines. Lower than plus-minus control lines is a negative rating. Equal to plus-minus is a plus-minus rating. Higher than plus-minus but lower or equal to 1+ is a 1+ rating. Higher than 1+ but lower than 3+ is a 2+ rating. Equal to 3+ is a 3+ rating. Higher than 3+ is a 4+ rating. The reactivity pattern on each strip should be interpreted based on the table given in the package insert. Let's have a look at some examples. If there are no lines or only one line with a ± rating, the strip should be interpreted as negative for HIV antibodies. If the strip shows one line with a 1+ rating or higher and all other lines are negative or ±, the strip should be interpreted as indeterminate for HIV antibodies. If a strip shows two lines with a rating of 1+ or higher, of which one is an envelope 2 line and the other a P24 line, this should be interpreted as positive for HIV-2 antibodies. If 3 or more lines have a rating of 1+ or higher, of which one is an envelope 1 line, this should be interpreted as positive for HIV-1. Please note that, in the case of an additional ± rating being obtained for both envelope 2 lines, the strip should be interpreted as HIV positive but not typable. If 3 or more lines have a rating of 1+ or higher, of which only one is an envelope 1 line and only one an envelope 2 line, this should be interpreted as HIV but not typable. This means that it is not possible to determine the subtype. All INNO-LIA score assays should be interpreted following their specific interpretation guidelines. Please check the package insert included in each kit for the specific interpretation criteria for INNO-LIA HCV, INNO-LIA syphilis, and INNO-LIA HTLV score assays. The test is now complete. For more information on our products or guidance on how to use them, contact our customer service department.